Welcome to the Wellness Surge podcast with Dr. Adiola Oke. Each week, we discuss our wellness journey with real people like you and me. We have conversations about food, fitness, mental health, financial wellness, and much more, so you can get back to the real you. To make sure that you're up to date with this and other wellness topics, visit wellnesssurge.com. Information presented here is for educational purposes only and is not intended to diagnose or treat any disease. Please do not apply any of the information presented here without first speaking with your primary care provider. Now, let's head on to the show.
Hello, everybody. Welcome to the Wellness Surge podcast. My name is Dr. Adiola Oke, and today we have with us the awesome Dr. Sheri Nike Audu, and she's going to be talking to us about failing to take care of your teeth, how that can affect other parts of your body. All right. So Dr. Sheri Nike Audu is a dentist and owner of Museum Smiles in Fort Worth, Texas. When she's not practicing dentistry, she's spending time with her husband and her 3-year-old daughter. Her interest in healthcare and the art of a beautiful smile led her to dentistry. In summary, she finds joy in empowering her community. So, Dr. Sheri, can you take it away for us, please?
Yes.
Can you explain to us the effect of failing to take care of your teeth and gums, how that leads to disease in other body parts?
Great. So what I found over the years is a lot of people tend to think my grandparents or my parents never had to go to the dentist and they're just fine. And what I usually tell patients is we don't know if some of their other systemic health conditions resulted from them not taking care of their teeth and gums. And in addition to that, we have a population that is living longer. So we're seeing more conditions that we didn't see before. It's best to go in for a routine visit and have the dentist give you an evaluation. So if they tell you your dental health, your oral health is fair, they may put you on a once a year checkup schedule or twice a year. This is how we know if everything that we look for is on the right path.
Okay. All righty. So that's what you look for. But in terms of other body parts, right? So like, I feel like some people feel like you said, dental health is a luxury, right? Mm-hmm. But if you kind of start thinking about it, if you don't take care of your teeth, can it affect your heart? Can it affect your lungs? Can it cause pneumonia? Do you, are there any insights on that?
Yeah, so we do see there's a condition called periodontal inflammation, periodontitis. And
so what is that?
Please break that down. Periodontal disease is inflammation of the gums.
Okay.
And we often ignore it when our gums start bleeding. 50% of the US population, half of US adults have periodontal disease. It's inflammation of the gums that starts with just bleeding, gingivitis, and then it leads to the breakdown of the gum tissue and then bone tissue, and that's when teeth get loose. So sometimes when people have loose teeth and they try to bite into hard foods, it causes pain. There's a C-Reactive Protein that we find that increases with periodontal disease, and it also is linked to heart conditions. It's linked to heart disease. Okay. And we found that increased inflammation in the mouth can cause bacterial endocarditis, which is an inflammation of the heart tissue. So some people are more prone to heart conditions than others, and it is good to identify what can be increasing their propensity for heart disease.
Okay. All righty. So just make sure that I got this right? So C-reactive protein is like, and it's like one of those lab works, like when you go to the lab, it's something they check, right? Yeah. And it's a form of, it just is a measure of inflammation. It shows that there's some inflammation going on in the body. And so for people that have like inflammation in their gums, right, and their teeth, and you're starting to notice that they have a lot of this little marker that shows that there's inflammation going in the body. And this inflammatory, whatever, C-reactive protein, some big words, right? It's also being associated with like inflammation in the heart, right?
Yes.
Right? And that's what you call endocarditis.
Bacterial endocarditis. There's specific bacteria that we isolate and identify in gum disease that that can increase the risk for bacterial endocarditis.
And it makes sense, right? It just travels, boom,
Into the bloodstream.
yes, it makes
Into
sense.
the,
So close, right? So yeah, that
yeah.
makes. Is there any other body part like the lungs?
I would say it's mainly the heart.
Okay.
However, we do see that there's something called a dental abscess. And a
Okay.
dental abscess is when a cavity, the tooth opens up. And our teeth have blood tissue and nerve tissue inside our teeth. It connects through the roots of our teeth into the bloodstream. When we have bacteria or a cavity, that's an opening for more to enter into the tooth through to the bloodstream. So when someone has an abscess, it's basically where a part of their face swells up. When a part of the face swells up, it's the body's mechanism for isolating where the bacteria is. So there's a huge bump under the mouth, chin area, or there's a huge bump in the cheek area. The nerve tissue that we have close to our nose, under the floor of our brain, the maxillary sinus, and then the link of the blood tissue that we have in that area, it can take bacteria or infection that's in the mouth area to the floor of the brain. So it's very rare, but there have been unfortunate incidents where people have passed due to a dental infection because it crosses over into the floor of the brain area, or it causes the floor of the mouth to swell up and they cannot breathe.
Wow. Oh my gosh.
So that is all because of an abscess. So earlier we talked about bacterial endocarditis, which is heart disease because of periodontal disease. That is more chronic. That's something that takes place over a longer duration of time. However, with a cavity and an abscess, that is a short-term acute reaction that we see that has hurt even children before.
Wow. Wow. And you know what? I think most people don't know, from my experience, most people don't know that they have cavities unless they go to a dentist and they tell them, you've got a cavity. And then you're like, what?
Yeah. And no two cavities are the same too. So if a dentist says you have a cavity, it could be 1 millimeter, it could be 2 millimeters, it could be 4. So when we start getting into this area where it can result in an abscess, by then the cavity is 5 millimeters deep. And people don't know they have a cavity until it's about 5 millimeters deep.
Oh my God.
And my reaction when a patient says, I have a cavity is, that's usually an emergency. When a patient says, I have a cleaning, by then there's usually, I need a cleaning, there's usually periodontal disease. So it's usually more pronounced by the time a person notices it for themselves.
Okay. So what I'm getting is this, right? When you say, oh, maybe I'm starting to feel something here, let me go to the dentist. It's probably already a big deal by then.
It's already advanced.
Yes. As opposed to like if you had gone for a checkup and somebody's monitoring you all the time, right? That's what I'm getting from all this.
Yes. And we have to mention the elephant in the room, which is a lot of people don't trust dentists. So by the time you get there, you're already thinking they just want my money. And I don't take trust lightly because I've been a patient in many different clinics where I have to develop trust with a doctor. So I would recommend, if you don't feel that you can trust the information you're getting about your health, look for a word of mouth referral. Who treats your family members? Who treats people in your community? Who's involved in your place of worship? Who's involved with your children's school? That way, when you go in, you feel they have a vested interest in you. Or you can visit on a day where you're not going to be a patient that day. That takes the pressure off and you can just observe. You can go in with a family member that has a dentist and just greet them and ask them what they look for.
And so not even just that people don't trust dentists. I had a friend and she's like really educated and all that, but she was just scared to go to the dentist. You would think it's something so trivial, but she kept postponing her dental appointment in the past just because she just didn't want to go there. In the past we have this view that, oh, they're going to be using sharp objects and this and that. And initially, it took me some time, right? Initially, I used to think that too. But now I feel like it's so much better, like compared to what we used to think about. So can you talk on that?
We have different levels of sedatives. We have everything from laughing gas, which is nitrous oxide, to...
So what does the laughing gas do, right? What does
laughing
it do?
gas is a nose mask that you wear over your nose and mouth. And it's just this type of air that you breathe in. They use it in the operating room, and it makes you relaxed. It removes the anxiety, the edge. It takes the edge off. So you're awake. And after the laughing gas is off, you can drive yourself home. So laughing gas is the first level for mild anxiety. People often enjoy getting laughing gas. So the next level is you may use diazepam, Valium, which is a pill, the little pill that you take 30 minutes to an hour before your appointment. Okay. So you can use that level. And then we get into the IV range where it's IV sedation. And then the patient is in the twilight zone. They're very drowsy. They cannot drive themselves home if they get IV sedation, or even some tablets for sedation.
Okay. So just summarizing here, right? So, laughing gas, I know my kids have used that. So that's like non-invasive. It's just something you put on your nose. And so it just calms you, relaxes you. And so you go from the nose, you can use a tablet, right? Okay, what I'm getting is people should not be so scared. Should not be so scared. And so apart from that, so like people are scared they don't trust dentists. They just want to get their money, right? That's all the negative connotations we have. The other is, I'm scared. I don't want to go. They're going to poke and prod with some object. But you know what? There are things to take the edge off, and there are other ways to like keep you calm and pain-free too. And then the third is, this is the big one for me, okay? I feel dentists are expensive. I feel they're expensive, okay? So how can we make it more affordable? I'm like, gosh, man, how much did they just charge me? And I have dental insurance. Come on, people. So how can we make it more affordable?
I think people should look at their dental insurance plans, because sometimes we have patients who come in for a consultation without dental insurance. And when they don't have dental insurance, they look at their plan and go and sign up for an insurance plan that doesn't cover much. So I usually say, this is a very technical part. When you sign up for dental insurance, make sure they cover at least 100% of your preventive services. Make sure they cover about 80% of basic services, because you have some insurance plans that may cover 50% of preventive services or 25%. So look for something that covers a higher percentage of what you need regularly. And then after that, check for deductibles. If your dental insurance plan is great and you're not interested in changing it, the other thing to ask the dental office is if they have any participation plans, discount plans for families that know they're going to be coming to that office yearly. And then there's care credit, but many people don't like using care credit to cover healthcare expenses. So those are some.
What is that?
Care credit is a credit card that you can use at a vet office, optometry office, and any person in the family can use it. So it really is a credit card, but it's meant to be used in only healthcare offices for any type of physician that a member of the household needs. Mm-hmm. So care credit is often more useful for people who have an emergency procedure that they need and they cannot wait or have the luxury of planning to pay for the treatment that they're getting.
Okay, so I like to summarize to make sure I got it, because I'm thinking about myself too, because I'm like, how much did they just charge me? so look at make sure they're covering 100% of my preventative services. So if I have insurance, they're covering 100% of my preventative services, and then 80% of basic services, right?
Yes.
And also look at deductible. So what if you don't have insurance and you want to make sure you don't get an abscess and end up in the morgue?
Or
What can you do? What can you do if you don't have dental insurance?
If you don't have dental insurance, you can look for an office that you want to be a part of and ask them if they have a member patient participation plan.
Oh, okay.
Usually you
Okay.
can get this for a few hundred a year, and they'll cover you to
And
go in for,
you can pay in like monthly, right? Kind of thing.
or you just pay once for the year, what you normally pay your dental
Oh,
insurance over 2 months. You pay the
oh,
office once for the year, and then they allow you to come in twice a year at no cost.
oh,
So
okay.
that takes away the copay, it takes away the
How much is that
percentage.
usually? Do you,
Um,
like
I
rough estimate?
Offices can do that for anywhere from $250 a year to $500 a year.
Okay.
And in many parts of the country, this is what patients pay for 2 months of dental insurance.
Okay. Okay. All right. So that sounds fair, right? And
Yeah,
you can, I guess it's some part of like dental health is part of general health care. And I guess we
it
just
really
need to,
is.
yeah, we need
Our
to do
diet
but
is changing. We're using our teeth in ways we've never used them in the past.
mm-hmm.
Our sugar consumption has increased significantly. So with our changing diet, it requires our body, our teeth to last longer. And there's
Mm.
no replacement for natural teeth. There's just a replacement for missing teeth. So
I have this coworker. I just remember he talks about metallic. Like, can I go change all my teeth to get some bionic teeth or something so we don't have to deal with this? But we
yeah,
can't, right?
yeah, there's no replacement for natural teeth and the way they feel. So the replacement once teeth are gone includes implants, dentures, and it's near just as great, but it doesn't work in the exact same capacity.
Okay, okay. All righty. Well, so that's some great insight right there. Okay. All righty. So we've talked about a lot today, right? We've gotten some good insight, like, our teeth is you need it to last for a long time.
Yeah,
Other, we don't want to have a cavity that blows up into an abscess, right?
yeah.
And so what is one
Periodontal disease.
periodontal, yeah, all this big word.
Periodontal disease and how it's linked to heart
To
conditions
the
as
heart.
well.
Okay, so like the inflammation in the gums, right? That's the
Yes,
periodontal
inflammation of the gums that
gum.
affects the bone around the teeth and eventually can loosen up teeth.
Hmm.
So those are the two main types of dental health conditions. The rare condition that we look for, which is part of a comprehensive head and neck oral examination, is oral cancer.
Hmm.
Oral cancer is also a rare diagnosis, and it's we have to check for it when we do our oral examination, because by the time it's found, it's often also very pronounced.
Hmm. So that's another reason why you want to get a dental checkup. And so it's like
Yeah.
every 6 months, right?
Yes.
Generally, if it's just for like a basic, it's every 6 months, right?
Yes,
So,
for a basic, it's every 6 months. And there's some people who can get away with once a year visit, and those patients often know who they are based on what their dentist is telling them from the evaluation and the feedback they're getting.
okay, awesome. I wish I was one of those. I just had to go in once a year. But if you grew up eating chocolate for breakfast, cereal for lunch, and whatever, so past I wasn't so good. Now I'm like, okay, I need to take care of my health. I'm on this health journey. So yes, I'm paying for the sins of the past. What can I
And
do?
prevention. And then we can talk about home care prevention too. So
Oh
there's water,
yeah.
the
Okay.
frequency of water intake. So it's not the quantity of sugar that hurts teeth, it's the frequency of sugar intake. And the summary is that when we're done eating something acidic, the pH in our mouth is what causes cavities. The
Okay,
pH in
hold
our
on,
mouth
hold on,
will,
hold on, hold on. So it's not the quantity of sugar, it's the
it's the
frequency
frequency.
of the
Yeah.
sugar.
So when we're
Okay.
done eating, the pH in our mouth will get, let's say you just had an orange, the
Mm-hmm.
pH in our mouth is lower.
So it's
Anytime
acidic.
it's acidic.
Okay.
Anytime the pH gets below 5.1, that's when our teeth start demineralizing, losing mineral.
Okay.
But when it gets above 5.5, our teeth can start to remineralize again. So we get done eating a really sweet snack or having a fruit snack. We can drink some water and have our mouth come back up to the right pH, where our teeth can get stronger and harder and remineralize.
Oh.
But if every time our mouth bounces back to a normal pH where our teeth are remineralizing, we consume again another acidic beverage or snack, then we're never really in the repair part of the pH scale.
Okay.
We stay more in the demineralization part of the pH scale.
Okay. Every time we're eating, our mouth is getting more acidic. And then as we drink water, right, it becomes more alkaline, right? And
Exactly.
it helps rebuild, and
Exactly.
the teeth and stuff like that. I'm just trying to get it into
Yes.
and understand it better. That's good stuff right there. So you have to drink water every time you.
Exactly. So when people have a Coke, the best thing to do is drink that Coke as quickly as possible and let your mouth rest. But if you sip Coke throughout the day, because some people sip lemon water throughout the day, and lemon water is great for you, but also drink that through a straw, drink it as quickly as you can.
I did not know this.
Sipping lemon water or sipping Coke is what hurts teeth.
Oh, I did not know this. Wow. That is a golden nugget right there. Like seriously, we need to pay you big bucks for this information. Seriously, man, this is really wow. Okay. So drink your Coke as quickly as possible. Don't be sipping lemon water all day. If you do that, use a straw. So the straw protects your teeth.
Your front teeth anyway. The back teeth will still wear down. And I've seen cases where just from lemon water, which lemon water is great for us. Just from lemon water, people have had their teeth wear down so much from acidic erosion that they couldn't keep those teeth.
Oh my gosh, I love apple cider vinegar in my teeth and I drink it a lot.
Yeah. Or sucking on lemons, and those are habits that wear down our teeth.
Okay, so drink it really quickly and then drink water to clean up everything up.
Yeah.
Oh goodness, this is like golden nugget right there. This is big. Okay, so this is really good. Thank you. So is that the one thing you want people to make sure they take away? Like drink a lot.
That's the main thing. In addition to that, you can look for a fluoride mouth rinse at a store near you, any pharmacy near you. ACT Act, they have a mouth rinse that has fluoride in it, and fluoride helps remineralize our teeth. It actually replaces the ions in the teeth. And there are many families, many professionals who don't want to use fluoride.
I was going to go there because my toothpaste does not have fluoride in it.
Yeah. There's another paste that's sold online. It's called MI paste. And it has a milk protein in it called casein phosphate. So the active ingredient that helps you remineralize your teeth is not necessarily fluoride. It's more of the milk protein that it has in it. There's some studies of iodine as well, but I don't know the concentrations that help teeth remineralize.
Okay. So would you say that the MI paste that has the casein in it will be better for people that don't want to get like the extra fluoride and the other garbage that comes with it?
Yes. MI paste with the casein phosphate. Yes.
So is it like a rinse or is it like a toothpaste?
Oh, it's a paste. It doesn't foam. It's just a paste. It just helps the teeth get harder. It can help reverse cavities in some cases.
Are you serious? I need to get some.
Yeah. I have some here, and I have patients that I just recommend for them to use that around the year.
Oh, wow. MI paste. I'm going to look for it. Okay. That's awesome. Thank you so much, Dr. Sheri Nike Audu. So how can people get a hold of you after the show if they have questions or say they want to use you as their dentist?
So I'm located in Fort Worth, Texas. You can find me by emailing us at Museum Smiles. Our office website is museumsmiles.com. We're located in the museum district where all the museums are in Fort Worth. So it's really easy to find us off West 7th.
Awesome. I really enjoyed this chat. I learned a lot. So I hope you did too. So, I hope you all have a wonderful week and enjoy the rest of your day. Okay?
And thank you very much. I'm glad we got to have a chat, and have a great weekend.
You too. Bye-bye.
Bye.
Join our Wellness Surge Facebook community so that you can implement what we learn together. I am because you are. Thank you for listening and sharing your precious time with us. If you enjoyed the show, then follow us and subscribe on iTunes, YouTube, or any app that carries podcasts. Have an awesome week. Best wishes to see you thrive.